welcome to this joint session of the Eugene City Council and Lane County Board of Commissioners. I now call the December 8, 2021 City Council work session to order.
Good afternoon, and following the mayor, I now call the December 8, 2021 Lane County Board of Commissioners work session to order.
Thank you all for joining us in this remote meeting format we're using as our state and community recover from the COVID-19 pandemic. This format enables us to meet and take care of business while keeping everyone safe. For work sessions like this one, where there is no opportunity for public comment, those wishing to access the meeting can do so by watching the live stream available on our website, the broadcast on Comcast Channel 21, or by calling into one of the phone numbers listed for this meeting on the public webcast and meeting materials web page. And as always, other avenues of communication with me, the city councilors, and the commissioners are available, including email and voicemail. Thank you again for joining us. And with that, I believe I'm just turning it directly over to you, Sarai.
Thank you, Mayor. Thank you, Chair, councilors, and commissioners for having this meeting today to talk about what's going on in our homelessness systems in Lane County and City of Eugene and our partnership on that front. Before I dive in, I thought it would be useful to acknowledge a couple of big transitions that are happening right now. One, Steve Mannella has officially retired as the Human Services Division Manager and is moving into some special projects soon after 40 plus years of service for the county, which is amazing. So I wanted to acknowledge his contributions and his work. And then Karen Gaffney also is retiring from her position as the Health and Human Services Director, and after many also wonderful years of service to the county. So thank you, Karen and Steve, both for all you've done to build the system that we're working on right now. So thought that was important. And then of course, Kate Budd, who is here today, is new and just started last week, and she is now the program manager for the housing and homelessness team in human services at the county. So we're really, really lucky to have her, and I'm sure you'll all get a chance to get to know her pretty well over the next coming months. And look, you can even see her face here. Hi, Kate. So hello. A couple of hello. A couple other things I wanted to just make sure that folks were aware of is one of the achievements we've been able to get excited about in the last few months is the All Hazards Shelter Task Force, which is working across jurisdictions to develop an all hazards approach to sheltering and helping people shelter in place throughout inclement weather. As you know, we have more hazardous weather than ever, likely due to climate change. And so we are working together with our service providers and emergency management departments to find really clear ways to activate and celebrate, or not celebrate, but coordinate so that we can help people survive in extreme weather events. There's a kickoff coming up on December 13th at 4 o'clock. It's a come one, come all session. So anyone is welcome to join that conversation, and that work will continue on. And then finally, before we start, I also wanted to mention that December 21st, which is coming up soon, is the National Day of Remembrance for people who have died while unhoused in the United States over the last year. And we, of course, have lost several community members in that way. Reports from service providers indicate maybe a couple of dozen folks have passed away while unhoused in our community. And so that day is coming up on December 21st, and there will be a vigil at the park blocks from 7 to 8 in remembrance of those folks. And now, without further ado, we shall begin talking about this. Okay. Everyone see my screen okay? Yay, thank you. Today we're going to talk about quite a few things. Some of them will be short, some will be a little bit more expanded. Some of these things are a little bit complicated, so I'm going to do my best to keep it simple and high level, but of course you'll all have time to ask questions and give comments at the end as well. So first, we're going to cover some of the most recent updated information around our shelter inventory and our homeless by name list. We'll do an update on the navigation center, coordinated outreach, coordinated entry, and then landlord strategies. And then Steve Mannella will hop in and speak a little bit more about capacity building at the end as well. So this year, this is our year-to-date numbers over the last 3 years since we've had the homeless by name list for full calendar years, are unduplicated counts. So as of November in 2021, we've had 7,955 people who are experiencing homelessness as a part of our homeless by name list. That looks like we're probably pretty close to on trend with what we've been seeing over the last couple of years. Last year, 9,107, and then in 2019, 9,679 people experienced homelessness in Lane County. Now, what we have also experienced over the last year and a half is a much greater visibility of people who are living, especially those who are unsheltered and living in places not meant for human habitation. Mostly as a result of some of the constraints of the pandemic, a lot of these folks have come into more public places than they usually had been camping. And so we see a lot more of it, and it impacts the core of the city in different ways than it did before. Although we can see that the numbers of people who are unhoused has been pretty consistent, and in fact has started to level out around 9,000 unduplicated folks per year compared to past years. So if we go back to 2018, we're about 15,500 people, almost 13,000 in 2017, and so on. So you can see the numbers kind of fluctuate. Back in 2014, we were close to the 9,800 number, and then a little over 10,000, or well over 10,000 in 2013. So these numbers all come from our PIT reports, where we did report on duplicated counts to HUD through that methodology for many, many years before the homeless by name list came online. So I think it's helpful for us to ground ourselves in the reality of how many people truly have been experiencing homelessness in our county and our city for a very long time. And while these numbers only go back just a little bit less than a decade, we definitely could see probably very similar trends for quite some time before that. And as of November, the distribution of where people are living is pretty on par with where we've seen it in the past. About 78% of folks in Eugene, this is as of November, this is from the November homeless by name list, 11% in Springfield, and then 3% each in Cottage Grove, Florence, 2% in Oak Ridge, the rest of rural Lane County, and then a small amount of people receiving services who are outside of Lane County. So that is the distribution of where folks are. And of course, again, it comes as no surprise. People are where we tend to see them, and Eugene is the place where most people are going for services. And of course, probably relatively aligned with the population of Eugene compared to the rest of the county. I do have some good news, which is exciting to finally have something good. So we have, of course, over the last year and a half, been talking quite a lot about our shelter inventory. And as you can see here, in June of 2020, the month that we demobilized some respite shelters that we had put up just for the purpose of helping people through COVID-19, as we saw bed reductions begin as early as March and April. We really hit kind of a low point as far as emergency shelter beds in June of 2020. And we've slowly seen that number start to recover, although we're not quite back where we were at the beginning of before COVID-19 hit. However, we have also been able to build in a number of alternative shelters that exceed what we had available in the past. So you'll see in February 2021 is when most of those programs showed up in our homeless management information system. And that was largely a result of adding pallet shelters to the community, the city of Eugene opening several new rest stops, and a number of other well, mostly pallet shelters, more new partnerships with new agencies to run additional projects. So as you can see, our alternative shelter numbers have expanded quite a lot, from a little over 100 to nearly 400 currently in circulation and available. And then finally, drop-in shelters, which is really the thing we're talking about when we're looking for where can people go tonight or right now. Drop-in shelters are a subset of both alternative and emergency shelters. So it's not additional capacity, but it is just the specific kind of, I could show up today and hopefully get a bed tonight. at a shelter. So we've seen that reduced by nearly 100 beds since February of 2020. And that too doesn't show a ton of signs of fully recovering. And so that's a challenge where we have at least additional capacity for emergency and alternative shelter. Typically, those are more skewing toward programmatic emergency and alternative shelter, meaning that each of these different agencies that runs these types of shelters are able to hold their own wait list and are the ones doing the selection for who comes into the program. That is okay, because that's their programs. And it's also challenging because we have fewer beds actually available to people who need a place to go right now. That said, more coordination and better collaboration among all of the service providers and the county and city together can improve this picture, I believe. And so we'll be continuing to work on adding shelter and more places for people to go in the immediate term. Speaking of more places for people to go, the Navigation Center, as you know, is our 75-bed low barrier shelter that the city of Eugene and Lane County are working on hand in hand to get to. This, of course, is one of the TAC recommendations and one of the key priorities that we've been working on since 2018. We are starting demolition this week. So we are happy to see that the building is kind of being taken over by the construction managers, and that demolition will begin shortly. We expect additional work to continue on, of course, as the year goes on. We have also just closed our application deadline for proposals related to running the Navigation Center by a service provider. Unfortunately, we didn't receive any proposals, although that has been a trend, and we'll touch on that a little bit at the capacity building section. So as a result, the program team has gotten together and we're working out some plans for provider development. We're reaching out to a few different organizations who had expressed interest here and there around the Navigation Center process, and who may be interested in either running it or collaborating with other providers to do so. So we're working on that. We really would like to get a provider secured in the nearer term. So we'd like to have that group on board, hopefully toward the end of January, early February, so that all of the pieces can come together for launch in July of 2022. So we plan to open the shelter as of July 2022. Probably it won't be right at that 75 bed capacity immediately out the gate. But a lot of what we're doing with this project is recognizing that it's a model we haven't used here locally in the past. And so we do have a lot of room in that program and in the design of the program to collaborate with whoever that provider is and work closely with them to check what's working, what's not working, what we could do to make things work better, and help to get to at least a solid benchmark on how many folks are we able to truly send off into exits into permanent housing, and where are the challenges on that front too. So not only will the Navigation Center serve as a place for 75 people to go and work closely on removing the barriers they might have to housing, and then hopefully be placed within into permanent supportive housing or refugee housing when those funds are available, but they'll also it will also operate in a way that will allow us to understand on the ground information about what works well as interventions and what isn't working as well. So I think this is going to be a really valuable project in pretty much every possible way that it could be. The street outreach update is, since James is on vacation this week, I'm going to keep it a little bit brief, but what we have is pretty full coverage of the county geographically right now. We have Carry It Forward is running a contract in Springfield and East and South Lane County. And then the county outreach team covers North and West Lane County. And we are also working with the provider to solidify details on serving Eugene for street outreach as well. So those conversations have been ongoing for some time. And I've been told that they are nearing a conclusion. So pretty soon we'll have street outreach available in the city of Eugene as well as throughout the county. And this is the thing I'm most excited about. And unfortunately, it's kind of a nerd thing to get excited about. So I'll try to keep you all excited about it too. But a couple of things that have happened along the work we've been doing on coordinated entry is we just recently formed a PHB, Poverty and Homelessness Board subcommittee and work group to work on the coordinated entry improvements that the internal team have been starting to map out. We also have great input from League, the lived experience subcommittee on the PHB, as far as what they've done for shelter mapping and wanting to see how the system can work better for everyone. We've developed a new vision for how entry and referral could be done. And then because of that work and because we're re-envisioning how coordinated entry can really support the entire system and improve people's experience through the system, we anticipate that it will have an impact on the overall system operation and make it work better for each individual. So right now, the way that it works is that somebody might present with a housing crisis. They probably don't know where to go unless it's happened to them before. So it's really challenging for them because there's no single place to go or a consistent source of information necessarily to help them get shelter, food, or other supports that they might need while they're dealing with their housing crisis. So people will kind of find their way through one way or another, talk to people and kind of figure it out, but it's not very coordinated. And there are a lot of challenges in helping people get what they need without duplicating services also. So then at some point in their journey, they may have a front door assessment done for them by a front door assessor. This happens at a variety of points in somebody's experience of being unhoused. And then that front door assessment assigns folks a vulnerability index score, meaning that there's a number associated with how likely they are, basically how likely they are to die without housing. And so then those folks with the highest level of vulnerability are prioritized for our housing resources, primarily permanent supportive housing or rapid rehousing. If their vulnerability score isn't high enough to qualify for those things, they may still be put on the centralized wait list, although they also may just be kind of out there. We don't have a strong kind of end wrap around that at this time. So this particular way that things are working, I'm generously calling a system, but really what we have to do is rethink how this all works so that we can really identify how does a person move from housing crisis to housing stability, and what do we need to do provide for them in between those 2 points so that they can successfully get where they need to go. So the vision for how this might work and what pieces are important, these all are identified by HUD and also called out really specifically in the TAC report, that we need better access points, phased assessment rather than just one front door assessment all done at once, dynamic prioritization. So not just here's your score, you're going to stay here and this is the place you are on the wait list for until further notice. And then ultimately referral, of course, to housing and also to support services, which again is not a place that our coordinated entry currently covers. Entry is right at that front door assessment and then into centralized wait lists. And those are the two main components of coordinated entry here right now. The future system, which we have not built out yet, it's not fully resourced. And this is really a framework for us to start the work with our stakeholder committee on the PHB. So this is a starting place. It will probably change and evolve a little bit over time, but the basic philosophy and concept is kind of captured here. So instead of when someone is experiencing a housing crisis, kind of having them figure it out on their own, where to go or who to talk to, we would like to create clear access points, including online access, calling someone or showing up in person, and then having the same information available to them at any of those points where they go for help. That would be phased assessment step one, which is triage. So what are the needs that this person is experiencing right now? How can I help you get safe right now? And then from there, everyone would be eligible for going through rapid resolution, which of course, you know, is diversion and rapid exit, meaning it's a strength-based approach to helping people identify what assets and resources they might already have in their network so that they can be sheltered or housed earlier and therefore kind of skip over the rest of the pieces and get back into permanent housing as quickly as possible. And from the estimates in our TAC recommendations, they suggested as many as 30% of people could be resolved in that way. We'll have to see how that works for us, but once we start putting it in place in this sort of having it have its own place in the system will help us to truly gauge that over time. If they are not resolved through diversion and rapid resolution, then we would move to an assessment for shelter and services. So what do you need shelter now? Where are you staying currently? Are there, we have a lot of work to do with our service providers to compile what are they offering, who is it for, and how do people get referred in? So that's going to be a bunch of behind the scenes work, but that will be a place where people can then get access to the shelter that they need, as well as other resources, whether that's employment resources or income supports or other pieces that they have a hard time getting. And then ultimately from that space, then we would look at the housing referral, and the assessment there would be that front door assessment or a housing needs assessment, depending on how it all gets kind of parsed out. Ultimately, all of these roads lead to permanent housing. And of course, it's not going to be a perfect linear progression for every single person who ever enters into the homelessness space. But the design of this is meant to support our prevent, support, house framework that we've been using, as well as to provide solutions for individuals who are experiencing a major crisis in their lives to get the help that they need and have some navigation as they move forward. Oh, and exits to housing is our plan. Other good news is that we have been able to resource the Landlord Strategies body of work, which, if you recall from July, we didn't have staffing for, and we just didn't have the capability of bringing that on. But since we've been able to staff up in a couple of other key areas, we are looking at starting this in January. So Steve Mannella has identified a human resource to bring on from his workforce team to work toward Landlord Strategies. Some of the outcomes or the deliverables in Landlord Strategies include a landlord by name list, better housing partner coordination, including housing partner coordinators and landlord liaisons, housing partner handbook so that we can help all of our housing partners maintain relationships with landlords in a consistent way, landlord case conferencing, and education and supports for landlords, as well as potential incentives for them. And ultimately, we're looking to help increase landlord participation in housing voucher and rapid rehousing resources and other programs, so we can open up more units for people who have a voucher or otherwise are receiving some kind of subsidy or assistance, which currently is really quite difficult for people to find those placements. And one of the reasons why things are so difficult, and really this is reverberating throughout all of the things that we've been talking about today so far, is our provider network has major capacity challenges. So while you saw the number of shelters or especially alternative shelters, has increased over the last year-ish, or at least since the kind of beginning of 2020, we still have a lot of challenges in making sure that all of those are staffed appropriately and that they have the right supports around them. Certain things that providers have identified as challenging to them include the way that the RFP process works at the city and county level. Mostly they've talked about it not being all kind of coordinated and timely in a way that would work for them. It's of course based on kind of when we have money available and when it needs to go out. So that's a challenge for them to meet multiple RFP deadlines all at once when sometimes they are clustered. Budget and funding has not been sufficient to meet the actual cost of standing up these different projects that we have asked these folks to take on in many situations. And so that's a challenge as well, especially when we're coming to them and asking them to start something that they haven't really done before. They don't really probably know how much it costs them to do that until they're doing it. And in that case, there's no easy way to have continuing budget conversations after the RFP and the contract has all been signed. One of the big ones that we're hearing, and we're hearing this from every level, is that burnout and mental health of the staff is challenged right now. As you all know, behavioral health supports are few and far between, and it's difficult to find providers for that. It's something that people who are working on the front lines with people who are in crisis and trauma are struggling with a lot right now. If you had a chance to read the agenda item summary, there's some information in there about the prevalence of mental health challenges, including depression and anxiety, have increased by as much as 300% across the general population in the US since COVID-19 started. So given the fact that that also disproportionately affects people with low incomes, I think it's pretty simple to extrapolate that people who are currently living on the street and also those who are working with them are likely experiencing even greater challenges with their mental and behavioral health because of that trauma that they're facing every day. Of course, admin and operations is always a challenge, and then workforce development and availability is big. Even for run-of-the-mill kind of direct service jobs, it's really challenging to find and place people in those jobs and keep them in them for any length of time. So I'm going to actually turn it over to you, Steve, to talk a little bit about some of the solutions that you've been working on, and we can kind of talk through those items. But first, I'll hit the TAC one because I forgot to say it. Sorry. Sorry, psych. So the tech recommendations, many of them are around centralizing and coordinating different activities and efforts. I think that those have the ability and the promise to be naturally capacity building in themselves once we have developed and launched them. So I do think that by making some of the changes we've already anticipated, we'll be adding some level of capacity to the system, both internally to the county and city, as well as with our service providers. And now for real, Steve, I'm going to stop talking and give it to you.
Thank you, Sarai. Good afternoon. I think that one way to look at what we're doing these days is that Lane County and the city of Eugene have lots of strengths. We have a variety of nonprofit organizations that are well engaged over time. We have lots of people who are volunteering their time in the community. And we've seen that there are a lot of very generous people in the community who are very supportive of all of the work that we do. So I think that it's important when we're looking at some of the challenges around capacity building that we think in terms of a strength-based kind of approach to community capacity building. And we do have some opportunities, as Sarai mentioned. A lot of the TAC recommendations are improving the coordination between systems and organizations. There's a lot more work to do there, but I think the more we get the private sector, the public sector, the nonprofit sector, and then all the people involved in working on homelessness working together, the better off we are in finding solutions. Some of what we're doing is we're doing capacity building as we're developing projects. Both the city and the county are engaged in that work and are coordinating on that work. Some of it is that during the pandemic, many of our nonprofit organizations have been maxed out. They are having the same kind of issues around human resources that a lot of folks in the private sector are having with finding qualified applicants. And so we're working with new and emerging organizations like Community Supported Shelters, Carry It Forward, Square One Villages, and others, and really trying to nurture some community-based solutions. At the same time, we're providing technical assistance with administration and other types of organizational building kinds of pieces for those new providers. In our county workforce program, after engaging with the providers, we decided to develop a training program for peer support and community health workers. And what we have in the human resource area is that we need people at all levels of skill. The first level being people who have interest and have experience working in their community and would like to engage in getting additional training so that they can support people in their community who need their help. And so we have trained a group of 40 folks with the first phase for peer support specialist and community health worker. And this was an area that was identified by the nonprofits as an area that they'd like to get folks certified in to help with their workforce. We have ARPA funding from the state of Oregon and have requested funding from the county to continue to develop more of this work. There are opportunities to work with Bushnell, the University of Oregon, LCC, and PSU. And Mayor Bennis, I know along the way, has engaged those partners to look at what we can do to come up with people to do this work. As Sarai mentioned, the level of need among the population is such that this can be, trauma-inducing work. And so to find people who are willing and have the capability to bounce back from doing this work is very important. With behavioral health, what we're looking at there is that we have people with different needs and different levels of care that they're needing. And in order to provide that care, we need people with different levels of credentialing, qualified mental health professionals, and qualified mental health associates and peer support specialists. Those are all different levels of support. And what I could tell you right now is the biggest issue that we have among the unsheltered homeless population is at the intersection between behavioral health, public safety, and housing. And our providers are experiencing that the level of need among the population is such that they don't have staff who are trained or qualified to provide the amount of support that many of their consumers need. And that's a critical issue. Some of it is coming from people who have been chronically homeless and are in poor health. Much of it is due to what mental health professionals call substance-induced psychosis, where people have been using substances for a long period of time. Really, it's not new on the scene, but the bigger problem on the scene now is with the legalization of marijuana is the high potency and the inducement of psychosis among otherwise healthy people who then need additional level of care. And finally, one of the crowning things that the county is doing as a major initiative is to get a mental health crisis center established in the community to take care of the needs of folks with mental illness who are in crisis. And a part of this is not only establishing the mental health crisis center, but also the outreach work with mental health professionals who are able to go out into the field. And we've begun that work with some of our impact grant funding. Thank you.
Thank you, Steve. And with that, we can turn it back to you, Mayor Bennis and Chair Bernie, to lead us into the comments and conversation.
Yeah, thank you so much for this report. And I just want to make two quick comments before I go through the process, which is we have lots of strengths in this community, and part of it is because of your leadership, Steve Mannella, that you've built a lot of those strengths. So thank you for your many years of service to this community. And to you, Sarai, it's really great to talk about a very hard topic in such a sort of effervescent and can-do way. So thank you for bringing that attitude to this really hard work. Okay, we will proceed as we have in the past with alternate rounds. Counselors and Board of Commissioners will have 2-minute rounds, and in the first round will be 2 minutes, and then people who want a second round probably will hold you to 1 minute, just in order to enable more people to speak. So, and I will keep the queue for counselors. Commissioner Bernie will keep the queue for commissioners. So with that, I see hands raised already among counselors, so I'm going to turn it over first to Counselor Sarette.
Thank you, Mayor. Thank you, Sarai and Steve, for what I see as a very positive report. I'm really seeing the light at the end of the tunnel in terms of our coordinated efforts to be responsive to the TAC report and move towards the recommendations there. So while things are bleak in terms of the need, I would say I feel very positive in terms of the resources we have available to start to address some of the bottlenecks in our system, and then the political will to actually make those things happen, and having the staff on board to make it happen. So I do want to acknowledge Steve's fantastic, excellent service over the decades, and also really appreciate Sarai's incoming energy and focus as our strategic manager of figuring this stuff out for us. So very excited about that. So I'm really excited about the Navigation Center coming online. Feel much more hopeful about the mental health services with what Steve just shared there. Engaging landlords is so important and has been a really critically missing piece of our work. So great to hear about that, and excited to see that move towards a true coordinated entry system that makes the most out of our current services and resources and helps reduce the confusion people experience when they find themselves in need. Also very pleased with the progress on figuring out how, as partners, county and city are going to work on this capacity issue that we have with our social service providers. So I think I can leave it there for today. Thank you so much.
You might be muted, Joe.
Thank you, Commissioner Farr. Thank you, host, for muting me. Thank you, Mayor. Thank you, Councilor Sarette. I see a whole bunch of Eugene City councilors that want to talk, but I don't get to choose them. I do see that Commissioner Bozovich has his hand up.
Thank you, Chair. And I appreciate the presentation. I would kind of like to understand a little bit better the differences between emergency alternative and drop-in shelters. And if I added that up correctly, we have about 1,000 beds that way. I don't know what our current count is for permanent supportive housing. But where does, just so I kind of understand, where does the Eugene mission fit in that? Is that emergency shelter?
Yes, it is.
Thank you.
Do you want me to quickly explain the difference between emergency and alternative, which I should have done in the presentation?
That would be great.
Great. Emergency shelter simply meets HUD, ESG, Emergency Solution Grants, habitability standards. So it's a building that exists and it can check off a whole bunch of things. Alternative shelters is a name we have locally given to the kind of sheltering that doesn't meet those habitability standards, but still gets people off the streets. And so things like Conestoga huts, Opportunity Village, pallet shelters, and other sort of structures like that, car camping, et cetera, all fall into alternative shelters, where emergency shelters, yes, the mission, and then just a few other programs throughout town.
Excellent. Thank you. So with all that said, I'll just make a pitch one more time because we had a very similar presentation at the county. So that's probably why you're not seeing a lot of hands from commissioners. As I sit on the Public Safety Coordinating Council for years and my involvement with the Public Safety Committee at AOC, the big thing we've always had is evidence-based practices and then randomized control testing and other things to show effectiveness. And I would like to see us start connecting some of that need for evidence-based practices and measuring outcomes and seeing which ones of these sort of programs and shelters and is doing the best job of permanently changing people's lives around homelessness. Because that's the goal, really, is to try and get people to not be repetitively on that list. So I just, hopefully, as we move forward, we can start adding some of those outcome measurements to our contracts and requiring the use of evidence-based practices so we can understand whether a safe sleep site is an effective intervention or we're better off placing our money into some other intervention, because we are spending tens of millions of federal, state, and local funds on these efforts, and I would really like to see them measured. Thank you.
Thank you. Councilor Groves.
Thank you, Mayor, Chair, and I really appreciate the presentations, Sarai and Steve. It's gratifying to know that we are making some progress. And also, Steve, thank you for your many years of service. I think Councilor Surratt teed off really well on some of the issues, and I'm not going to retail that ground, but I do want to emphasize the piece Commissioner Bozovich talked about regarding metrics. I think that's incredibly important. I've talked with city staff about the possibility of coming up with a dashboard that's accessible to the public, because I'm frequently asked out in the community, how do we know we're making a difference? What is the progress? And right now I feel like most of it's anecdotal. So that's something I'd like to pursue. Also, I want to shift gears now and talk a little bit about ballot measure 110, also known as the Drug Addiction Treatment and Recovery Act. And I'm not here to try and talk about the efficacy of that, whether that was a wrong direction or right direction, but I do want to find out where the state is on some of this, this work. For example, one of the requirements of the measure is a new fund that will cover the cost of 15 new addiction recovery centers, as well as wraparound services to be managed by the Oregon Health Authority to be spread across the state. And these are supposed to be up and running by October 1st, 2021. Can anyone tell me where we are on that?
Here, Bernie, Sarai, Steve, I don't know if you, I'm going to insert myself and just say that the state was definitely kind of caught flat-footed by the passage of Measure 110. And so the rollout of those centers has been slower than what we would like. The Oregon Health Authority has issued RFPs for that now. And I know there is a coalition here locally that's applying for funds to become one of those centers. But the last I heard, we're still in process with the state in their selection and awarding funds for those. And we can certainly get you more details if you'd like us follow up.
Thank you. I would like details as we start seeing progress on that. And Karen, I apologize for missing you. Thank you too for your incredible service and leadership throughout our pandemic. Trying to roll along here. How do referrals currently work for services at the street level?
At this coordination, is that? Sorry.
For somebody, okay, our responders or cahoots, which are also responders, they come in contact with someone that obviously needs services. How are they entered into the system? I mean, I know in the past I remember when I was a responder, we were supposed to give them the 7-digit phone number, which, you know, really isn't practical. I'm just curious how we're doing that today.
I'm actually not totally sure how Cahoots does it. And I don't know if Steve, if you have more insight into that particularly. But the way that I believe that it happens now is that there are limited places for people to go. And it's the same challenge that EPD has with having places for people to go, places for them to detox or to kind of come off of whatever's going on, and or a safe place to shelter. So like as you saw in the chart, what we have is a combination of emergency and alternative shelters. And then the red line is the subset of those that are drop-in shelters. And so those are places where people could potentially get a shelter access at that time. And I'm not sure, Peter, if you have more to add to that. I'm sure you do.
Yeah. And so, you know, the information that Sarai is providing is our aspirational goal related to a system-wide response. In practice, what often happens, or what I often experience, is EPD or park staff will call staff in the city manager's office, say, here's the situation that we have. And then we typically reach out to the county, James, who's not here, so we'll talk about him, and ask him to deploy the county's coordinated entry team out to the location. And we've been very pleased at how responsive James and his team have been in those kinds of situations. And then I believe Sarai mentioned earlier, the city and county are trying to finalize a contract to expand outreach in Eugene. There's language in that contract that stipulates the outreach provider would be dispatched per a City of Eugene staff request in hotspots around the city. So just to add a little bit.
Thank you. It just helps me in the policy arena to understand the nuts and bolts. I see I'm running out of time. It's important that we get to everybody else. I may ask for a second round depending what gets asked. Thank you.
Thank you, Councilor Groves. I was wondering how you were going to get that last 8 seconds in. Yes, Vice Chair Farr.
Thanks, Chair Bernie, and thank you, Mayor Venus. You know, there's not enough time to talk about all the things we should be talking about, can be talking about, and there's not enough time to even ask questions to engage staff in responses, because staff responses aren't timed and they take a lot longer than the questions take to ask. So I'm not going to engage in that at this point in time. I'm going to skip directly to what Steve Mannella calls one of the crowning things that the county is working on. And it goes along with something that Councilor Groves has been talking about. And Councilor Groves and I have been spending quite a bit of time recently together talking about various things, including measurements and metrics. But the crowning thing that Steve Mannella was talking about was an adult crisis center. We are the greatest drain on our system. The greatest resource drain on our system comes at the intersection of behavioral health and criminal justice. When the EPD continually takes people who have been arrested, men and women who have been arrested, to the jail to be bucked, and they go out the back door immediately because it's a misdemeanor, and the jail is full of people who have been sent there by the circuit court, not by the EPD. Consequently, when the EPD and Springfield Police Department, who aren't here today, but when they respond to a crime in progress, let's call it a crime in progress, quite often it's because somebody is acting out on a behavioral health issue, whether it be a mental health issue, substance issue, whatever it may be. And the only place typically they have to take them is the jail. Well, the jail's not the right place. It's not the right place. It's almost never the right place. So we have to work together, the cities and the county, to build an adult crisis center. The momentum is there. The iron is hot. We have to coordinate our efforts and make certain that we're working together to make this happen. The governor's attuned to it, the state is attuned to it, and we have a whole lot of people who have put in a great deal of effort into it, including our monthly mental health summit that occurs, as I said, once a month. City of Eugene often is not participating in that. And the main thrust of that is how do we identify how to build, where to build, and how to operate an adult crisis center to relieve the pressure on the jail, but more significantly, find ways that people in crisis, quite often who are homeless or on the verge of becoming homeless or will be ultimately homeless, and also are frequent users of our system.
I apologize, Commissioner Farr, you're over.
I don't see my minutes, so we need to work together. I may get back in. That's all I need to say. Let's work together.
Thank you. I'm sure there'll be time for you to come back with a second round, Commissioner. So, Councilor Clark.
Thank you, Mayor. And I want to take off from there and say that I absolutely agree with Commissioner Farr. I think that is a critical point. And also with what Councilor Groves mentioned, I sent to all my colleagues and staff an article in the Atlantic recently about P2P meth use and the growing crisis that represents. And Steve, I was wondering if you would talk just a little bit more about that intersection of, I don't even know what to call it appropriately. Psychosis in, substance-induced psychosis. That to me seems on a bunch of fronts, one of the biggest problems we face right now that leads to all the other ones. Can you talk about that a little bit more in terms of what we're experiencing and how the system deals with it today?
I'm not an expert in this area. I know what I hear from other mental health professionals in our department and our medical directors and providers. But it really is that that the potency of what's available to people, including what's available to them legally, is such that it creates harm. When you think about it, if you go to a physician for a prescription, it's dosed, and so that the consumer has an idea of what it is that they're inducing, and it's dosed at a level that is not to be detrimental, and so we have a lot of people who are suffering and in pain, and so they are using substances that they're not aware of what the longer term impacts might be for them.
Yeah, that's my understanding too, from what I've read. And I highly encourage everyone to read the article I just mentioned to understand it more thoroughly. It's a very long article, but it's worth reading. And Sarai, thank you very much for all the work that you're doing. It's fantastic the way this is getting coordinated. One of the things that strikes me, though, in the language that's used and in the presentation is the idea, and I don't know a better way to say this, but the idea that how do I want to say it? I want to say that we're approaching this in all of our systems and all of our coordination towards those residents who are homeless who seem to want to get well. In other words, how to coordinate the resources for the folks who want to get well. What about the ones who don't? The ones who don't want services, don't want to stop using drugs, or don't feel they can, for example. How do we address that systemically right now?
That's a good question, Councillor Clark. Thank you. The way that I usually start with that is that it's not possible for us to know exactly what everyone wants, of course. And it's also challenging to assume whether or not people really want anything when they're in crisis or when they're otherwise experiencing regular trauma or, substance use and so forth. So it's the assumption that we're making while we're building out the system is that we would like to live in a community where nobody has to live in an unsheltered location that doesn't want to. And that the places that we're focusing on in this particular body of work is on how do we make it better for the people who need the help and support. Where it comes into folks who are disruptive or where there's criminal activity and things like that, I think what we're also working toward is a world where we have one criminal justice system for everybody, and that the consequences for breaking laws and doing criminal activities are the same across the board for people who are housed or unhoused. And so I think it's a bit of a challenge. Sometimes I use the example of when I was a foreclosure counselor and people used to come to me and be in crisis of losing their home, sometimes multiple homes, to be honest. So I'd ask for their documentation so we could put together a loss mitigation packet, and people would bring in a large bag of unopened mail. So they weren't opening their mail. They couldn't deal with their immediate crisis. They probably wanted to stay in their home, but it was hard for them to even get their brains together around the realities they were facing. And that happens exponentially more for people who've already lost their housing.
My question is subtly different because it's about the system rather than the person experiencing it. What are we doing is my question for those who, for example, won't go into a program that requires something of them and they're unwilling to comply with the requirements of getting the services. It's how we focus on treating that that's important to me. Can you speak more to that? Do we, for example, require of the receiving services, obviously other than addiction services, do we require people to not use drugs to stay in housing, for example?
So in the Housing First methodology that we are using, Housing First is about making sure people have adequate and safe housing, and then other barriers can be worked on while they're housed, theoretically. And so
forgive
that's
the interruption. Can you talk
Yeah.
about work done? That's what I'm trying to get to.
Mhm.
What does work done mean?
Help with their substance use or mental health treatment needs.
If they want the help,
Yeah.
right?
Yeah.
But not compelling them to stop using.
In some programs they are compelled, in other programs they're not. So I think really, in answer to your question, I think the best I can get to is we're trying to create an array of services that meet people where they are and adjust those programs and services to help each individual. And hopefully we're creating enough that folks will be able to move through those different things as they're ready for different progressive kind of moves.
This is where I think the problem lives, and I appreciate your time. Thank you.
Thank you very much, Councillor Clark. I'd just like to say I did read that article. Thanks
Awesome.
to you. And yeah, well, it's pretty disturbing.
Yeah.
Whoever's doing the time, I have to say this, I'm really confused. Boards of Commissioner meetings are not time driven. I've been training myself for this meeting, and when Councillor Clark was talking, it was going all over the place. So help me, stay with us here. I apologize, Commissioner Trieger.
Thank you, Chair and Mayor and colleagues. In the interest of time, and I believe the way the clock works is like in a soccer game, the clock stops when there's an infraction until it's resolved. So not saying staff comments are infractions and then resumes. I was wrestling with what to comment because a lot of what's been said, I completely echo. I appreciate the presentation. I wrestle a little bit though with the sort of Groundhog Day-ness of it all. And, you know, I don't know, I've been told I get at least a year to say I'm new here, and I'm quickly coming to the end of that, but I'm going to use it. I'm new here. And what I am really wanting to think about how we will launch into the new year is what we do with these meetings in a way that really moves this work forward. This is a really important, unique, and powerful opportunity to bring the two largest local government bodies together on this critical issue. And I just think there are tremendous opportunities. It's really important that we all get the same information at the same time, that we have shared language about how we talk about these issues. But I get frustrated because it feels like just as we get going, the meeting ends and we haven't really said what we're going to do with the fact that we all got the information in the same way at the same time with the same language. What are we doing with it? And we're hearing more and more the same issues over and over. I'm particularly concerned about the provider capacity, the provider system, and what we're doing to shore those folks up within our own governments and processes, but then as a collective impact opportunity that we could perhaps be making to ease those pinch points in the system. My only question I have for staff, I know we are on the Built for Zero. For those of you who don't know about Built for Zero, Google it, check it out. Really impactful and important way of addressing homelessness in communities. And we're on the map as a Eugene Springfield community, but I don't know what it means to be on the map because I haven't heard what kind of resources we're getting from Community Solutions or what that looks like or how that differs from the tax centralized and coordinated efforts.
Did you want me to tell you what it means to be on the map?
That would be great. Thank you.
Great. Yes. So we are one of, I think now over 90 communities who are part of the Built for Zero collaborative. What it means for us is that they have helped us extensively build the homeless by name list. And so that's the first place where we really achieved kind of a Built for Zero goal, which is quality data. We are now in the phase where we have the opportunity to work population by population to reduce those specific populations' chronic homelessness to zero, and then ultimately whatever that population is all the way to zero homelessness. There's an equation that I'll show you all sometime. So it means that we're working with them on the system. They have coaching, they have different cohorts that they run. There's a lot of different supports around it. And Kaiser Permanente is also really instrumentally involved in it too. I know Kate has done quite a bit with Built for Zero in Vancouver, where she just came from. So I'm excited to see where we can deepen that partnership over the coming year and really kind of put it on the ground and get it to happen in a more cohesive way.
Thank you. Councilor Keating.
Thank you, Mayor. Thank you, Chair Bernie and colleagues for the joint meeting today. My frustrations revolve around access, branding, and coordination. Sarai, you asked the $1 million question, how does a person move from crisis to stability? But you also recognize there is a need for better coordination between county, city, and service providers. My observation that service providers are frustratingly operating siloed. What, in your opinion, your professional opinion, what does better coordination between county, city, and service providers look like? Is there real-time coordination and communication? Going back to your slide where you talked about the housing crisis and simplified access, both online and telephonic and in person. Is there a case provider connected to a cohort of unhoused individuals so we can see or so we can have a strong end wrap? Could you talk about the coordination? And then I want to pivot to access and branding.
Certainly. Yes. So with increased coordination and collaboration, there are a lot of different ways to approach that. But I would say that to me, the primary thing is switching the roles around a little bit so that we're hearing from the people who are doing the work on the ground and responding to their needs and matching those needs and desires with resources we do have. And Brooke has something to add to that too. Or Peter, I guess.
Apologies. I was just going to have Peter jump in. He's been doing a lot of work with the county and providers, and he can talk a little bit about what that looks like on the ground.
Yeah, I think a good example of this would be the evolution of our Safe Sleep Site initiative. So as the city started working on the Safe Sleep Site concept, city staff pulled together providers across the spectrum, so shelter operators, housing navigators, et cetera, and began talking about we need to set up spaces that people can be legally. And through a series of 6 or 7 weeks, we identified from the provider perspective what would make those sites successful. We additionally did intercept surveys or intercept interviews with unhoused folk living in Washington, Jefferson and 13th and Chambers to get an understanding of what kind of environment they would like, that they think would be supportive of them. And so through those conversations, we developed a concept of what these safe sleep sites were. County staff were also a part of those conversations. So James in particular, and Catherine Ryan, when she was with the county, also participated in those conversations. And so we developed the concept for the safe sleep sites. And throughout the evolution of that concept, we've been regularly meeting with staff at Lane County to figure out the funding puzzle whereby the city has been funding the site development and the operations of those sites. And we've been working with the county staff to add services therein. The other piece of that is we are in regular communication with the operators of those safe sleep sites to talk about how they can deploy these sites as a continuum of shelter. We all know that individuals who are living on the street have different sets of needs and are amenable to different kinds of structures. And so as we develop these safe sleep sites that range from drop-in safe sleep sites, which are low barrier, you just show up, can I be here tonight? Are you willing to follow these rules? Yes, okay, come on in. So that would be the lowest barrier. And then the programmatic safe sleep sites have a higher degree of expectation for community participation than a drop-in site. And there are some folks who are immediately ready for that kind of environment right off the street, but there are lots of folks who aren't. And so we've been talking with our operators at the drop-in sites to say, hey, as you get to know people and have an understanding of who they are, and they've expressed an interest in a more programmatic shelter, can you make that referral that then clears a spot in a safe sleep, in a drop-in site for somebody who's not ready for the programmatic site? So I think that's an example of the type of coordination between the city, the county, providers, and people who are unhoused to build a more cohesive system. So I just wanted to throw that in there.
It's helpful. Thank you. And so thank you also to service providers and operators of said safe sleep sites. Our service providers, I would submit, are overworked, understaffed, and underpaid. But at least safe sleep sites are branded well. It is what it is. So I thank you for that. But as Sarai mentioned, there's, quote, no consistent source of information. Just about a month ago, I was helping navigate an unhoused friend, or helping an unhoused friend navigate services. And it was maddeningly frustrating when you're on our city page, which has been altered and corrected. I thank you for that, city staff. And the county page, when you go to Lane County's website to look for services, it's opaque. You cannot find where to go easily. You click on residents and it goes anything from animal services down to veteran services. You have to get into health and wellness. Then you have to scroll all the way down. And finally, in poverty and homeless, there are PDFs of the work we've done, but there is a dearth of connections to actual services. Can you, I'll pause there, Mayor. I see that I'm way over time if there's an opportunity for a second round, but I just want to make that access observation. Thank you.
Thank you very much, Councilor Keating. Yes, Commissioner Buck.
Thank you. It's good to see everybody today. I'm pleased to see the progress, hear about the progress from the TAC report. We have really been, I think, over the last few years, been developing a deeper coordination with the city. And I really feel like we've only tapped the surface. We've just begun as two, large policy-making bodies, and the potential that we have together to address this issue, I think, is greater than what we are currently talking about today. We have the TAC report. We're making good progress on the TAC report. But as I've mentioned in previous meetings, for me, it's a stale document. It needs to be moved forward, and we need a bigger vision as to what we can do together. I've also mentioned in a previous meeting, I'm very much behind a more regional approach together, as we need to fund resources in order to tackle the issues we've talked about today. I think we can do more there, clearly on the ground, for those people working the TAC report. I see that excellent coordination going on and growing. As we move up the system between the two bodies and other adjoining cities, that's where we have more potential to work together towards a more regional approach and include all our outlining areas, including our rural communities. I really hope that we can, in future meetings, explore that further. Thank you.
Thank you. Alan, Councilor Zelenka, sorry.
Thank you, Mayor Venus. Thank you, Sarai, for the presentation. Great update as usual. I love your enthusiasm and your energy. Karen, thank you for your work over the years, and special thanks to Steve Mannella. We go way back, all the way back to the Safe and Sound Project. But I don't think you understand the definition of retired, Steve. This is lots of good work that's going on. It does kind of feel a little bit like Groundhog Day, but this work is done in small increments, and we have to be satisfied with that over my years' experience with it. I really appreciate the partnership with Lane County. I think we get more done and we're much more effective together. We've made some progress. You know, in 2021 alone, 5 new rest stops, 100 new beds, 120 pallet shelters, the Commons at MLK, 51 beds, and then Nell's going to come online next summer at another 45. 907 shelter beds, I guess minus 117 for the motel program, which is going to end. So almost 800 shelter beds, which are permanent. That's a significant accomplishment that we've done. And I'm excited about the low barrier shelter NAV center coming online next year. The coordinated entry work is something we've been working on for a very long time, and landlord partnerships. We need more permanent supportive housing, but that's always true. I think it's really important to take care of our employees and their mental health and combat the stress and burnout. And totally agree with what Commissioner Farr was talking about. Mental health is significantly underfunded, and an adult system with crisis center would be great. We've been waiting for that for way too long. I did have one real quick question. How many chronic homeless people are there in Eugene? I know there's 2,586 people on average access it, but how many is that chronically homeless?
That's an amazing question that I don't know the answer to, but I can definitely ask Lisa Stewart to parse that out. An easy way, just sort of back of the envelope, would be to take the number of chronically homeless folks that appeared on the November homeless by name list and then assume about 78% are in Eugene. That's generally true. That's not a perfect equation. So I'd be happy to follow up with Lisa and her team to get you a real answer.
Yeah, if someone could get me that, what does accessing services mean compared to chronically homeless? Thanks.
Thank you, Counselor. I would just like to point out as a time check, it's almost 1:15, so we're not going to have much of a second round. And I know there are some city councilors who have not yet spoken. I want to really commend Councilor Clark for that article. It's disturbing, but I think it's insightful and poignant. I want to agree very wholeheartedly with Vice Chair Farr. 2 minutes is not enough time to dig deep. We talk about frustrations and thanks. So thanks to Mr. Mannella, Ms. Gaffney, and all those hundreds of other people in our communities who have given their lives to this, aren't known. Thanks to the people who are neighbors and volunteers and are working on this but aren't part of a system. I want to echo Commissioner Buck's point. The TAC report is stale. Many times we've mentioned it needs a refresh. And it's not wholly defining of all those who need shelter in our communities. I really believe we need a regional approach. I really believe we need mechanisms not to replace this joint elected official meeting, but in addition to it, to dig deeper where we all have the opportunity to dig deeper into this. The mayor knows we talked about this, that I'm going to request that if we do develop that more regional approach, we immediately bring at least the city of Springfield. I've spoken to the mayor of Springfield who would like to be engaged in a regional approach, and Springfield has issues and contributions to make, as do many of our outlying rural communities. There's not time to get into, but I know one of the gorillas in the room as we talk about the intersection of mental health, behavioral health, public safety, is that when EPD expands its number of officers and expands arrests, where does it send people to? Eugene doesn't have a jail. And yet the jails of Lane County and Springfield are mainly housed with mental health, with people with mental health issues and homelessness issues. So here, there's 7 seconds left. I haven't touched the surface. It's a pleasure to work on this with you all, and I hope some of my words resonate a bit. Thank you so much.
Thank you. I do have three counselors lined up for a second round, and I see we have one commissioner also. I want to just jump in just briefly in response to some of the comments folks have made about this is Groundhog Day and what are we doing here? And I just want to, and that the TAC report is stale. And I just want to say one thing, which is that Council and Board of Commissioners established a policy around the recommendations from the TAC report, how we would move forward. And that policy still is in place. So the numbers may be adjusted. There are aspects of it that could be expanded. There's nothing stale about receiving an update. This is your opportunity to confirm that those policy decisions and that policy directed as implemented by staff is going in the direction you want it to go. And so it is your moment to say, I want more investment here or less investment there. I think we are hearing a lot about accountability, and we're certainly hearing a lot about a more regional approach. And so I think that is the kind of takeaway we hope staff will take with this, is that there's interest in that kind of regional approach. But this is an update, and it's a chance to weigh in that way. And with that, I will turn it over to Councillor Syrett for a 1-minute second round.
Thank you, Mayor. Thanks for that reminder. I think that's really important. And I just wanted to maybe make a suggestion around Commissioner Trieger's, concern that we get together and we're not really digging into the policy, is that maybe in addition to these broader updates, we could have a joint session that focuses more on one particular strategy or programmatic need, such as service provider capacity, the mental health services, the metrics for accountability and measuring, are we reaching our goals? So that's one way we might be able to dig in more deeply into a particular topic. I also wanted to say I appreciated Councillor Clark's sharing of that article from The Atlantic. I read the whole thing. I found it very enlightening. And I think even the little bit that Steve Mannella shared with us about challenges are reflected in that report. And lastly, Commissioner Farr mentioned that Eugene is not participating on a mental health crisis center conversation. I would ask if city staff could follow up with him and find out what that is, and if there's a way for us to make sure we're engaged on that if we're not. Thanks.
Thank you very much, Councillor. Commissioner Trieger, 1 minute.
Thank you, and I'll be brief. I appreciate the mayor's comments and Councillor Syrett's follow-up, and so I will just say succinctly what I'm asking for. The programmatic updates are important. They're enlightening. They're encouraging. What I'm saying is I don't hear policy discussion, and we are two policy boards, and that is the missing piece for me that I would like to hear more about, and I would like to hear us collectively agree on some policy direction and develop some policy-driven solutions that we want to move forward, not just continually update what we already are doing, not to diminish the value, the importance, and the effectiveness of the work we're doing. But that, just to be clear, and for example, Commissioner Farr talking about the Adult Crisis Center, clearly there's going to be policy work to be done to bring that to fruition. Councillor Grove's comments about Measure 110, that was policy passed by the voters that has policy implications for our bodies. And the providers, we're hearing from them not just about wages, but there are OARs that create barriers to them getting adequate reimbursement for the services they're providing. Those are policy opportunities that we could be developing a coordinated advocacy approach to help address. Thank you.
Thank you. Councillor Clark, 1 minute.
Thank you, Mayor. Commissioner Trieger, your first year is now officially over. This is the first time I get to say this. I agree entirely with what you just said. Absolutely. And in line with what the mayor mentioned, that was kind of my reason for bringing up the issues, both around the article that I mentioned and the issues that I asked Steve about. Is that I think while Alan mentioned the list of accomplishments that have taken place in the last year or two, they're real and they're awesome. And the staff has been doing a fantastic job to accomplish our goals and our policy goals around the TAC report. But the problem's different today. And I think we need to be looking at new policies to address new problems. And the easiest way to know that is to know that while we've accomplished all these things, the emails and the information from the public would be their perception that homelessness is getting worse, not better, despite the work we're doing. I think there are new directions where we should be talking about new solutions, like what Commissioner Farr said and like what Commissioner Trieger said. And I think a lot of them revolve around how drug use happens in our community and the consequence. Thank you.
Thank you, Councillor. Commissioner Farr.
Thank you, Chair Bernie. I hope it'll take less than a full minute. To you, Councillor Saret, I didn't, if I implied that the city was not engaged in the discussion surrounding the crisis center, they are. We have multi-jurisdictional and intergovernmental committees where a lot of that discussion takes place, the Poverty and Homelessness Board and its subcommittees, where the cities of Springfield and Eugene and Lane County are all participating actively. What I'm talking about is the Mental Health Summit, where we talk about specifically how do we fund it and how do we staff it and operate it. And that's where the discussion is ripe. And thank you for asking staff to participate. They already do, and we can talk more about how do we pay for this thing.
Thank you. Councillor Keating.
Thank you, Mayor. We rarely talk about the number of folks who are on the edge of being unhoused. I think that there is an opportunity here to bring these bodies together for a more robust retreat around reshaping the TAC report, TAC 2.0 in 2022. Because we don't have the time in an hour and a half to really do the deep dive. So, Mayor, I, with respect, request that, and Chair Bernie, I request that the County Board of Commissioners and City Council and hopefully City Council of Springfield come together in 2022 for a joint work session retreat. This work, we need a Saturday. We need a weekend to do the deep dive and have that policy conversation with service providers. That's my request, Mayor, and thank you for the opportunity to share.
Thank you very much, Councillor Keating. I have a word or two, but are there any other commissioners that would like to speak? I think this has been great. I think this has been healthy. I would just like to share that we as a group and all of the people that are dedicating their lives and their work to this issue are working against something called the market. And the market is more powerful than anything we can do. And I'm going to defer to Councillor Clark on this, but my understanding is, for example, as home prices go up, conventional loan price limits go up. As conventional loan price limits go up, I think they're up to 550,000 now, and I think they're going to go up to 650, is it, next January even? Okay, look at what that does to prices and demand and the population that we're serving. So one of our challenges, which I think we can get to, is how do we leverage the small amount of public dollars we have to incent the market to start filling this need? And I think I'd love to get into that in the kind of retreat or get together or whatever it's called that I think Councillor Keating was referring to. Thank you. Mayor?
Thank you. I also appreciate this conversation, and it's clear that we need some follow-up, and it's clear that we need a list of possible new policy discussions and directives that this body might want to look at. And so I think that will be a good conversation. We have talked in the past also about reprising what we did in the beginning of the TAC report of having a smaller steering committee that would sort of crunch through and make a proposal about how to do that. And that might be a way to plan for either a retreat or a series of conversations between the councilors and the board members. So I think all those doors are open, and I think it would be very interesting as you reflect on this meeting to sort of weigh in on what's your list of policy discussions that you want to make sure that we consider to add to this conversation. It sounds, I think the time is ripe, and so I appreciate Commissioner Trieger and Councillor Keating and others weighing in on what those policy issues should be. And with that, if there are no other questions or comments, we are actually adjourned 5 minutes early. So thank you all very much. Great report. Oh, do you have?
The Eugene City Council
is adjourned. Yes, sorry.
Board of Commissioners, we have a lot to talk about.
You can keep going.
forgive me. I thank every member of the Eugene City Council and every one of our commissioners for participation today. And the meeting of the Lane County Board of Commissioners is now adjourned. Thank you.
Thank you.
Thank you.
Bye all. Have a good afternoon.